My name is Della and my family is a working poor family. We live in the hood on Avenue W. We've been in this area since 2003. I have two boys, Jaden, who is 10, and Jared, who is 4. I was trained as a medical office assistant. I started a family and we couldn't afford to send our kids to childcare every day, so I stayed at home.
Morning.
Morning. See you guys, I'm off to work. See ya.
See ya.
For the past 2 years, I think it is, my husband has worked as a custodian. I believe that he's only working 7 hours every day, well, Monday to Friday. So that in itself tells you how much we have to budget our money very carefully. We haven't been able to afford the stuff that we need to look after or maintain our house. We can't use our kitchen sink. We haven't been using it for a few months for the reason that we aren't able to afford a plumber at this time to unclog our drain from our kitchen sink, which goes to our washing machine, the same drain. We can still use our washing machine, but we have to drain it into our bathtub. It's kind of inconvenient, 2 kids that are young that need their clothes washed. I'd love to have a house in Willow Grove somewhere or have the stainless steel appliances with it, along with a washer and dryer and everything. But maybe one of these days, we'll see.
A good analogy is looking at people lined up to run a long-distance race. For many people, it seems like they're always running downhill on level ground. For other sectors in society, it's more like running a race where there's hurdles and big walls and barriers. And that's what faces many people in our society due to discrimination, family backgrounds, disability, where they live, who their friends or supports are. Those types of issues unbalance the scales in a way that makes it difficult to say that you're running the same race.
Well, I've been diabetic myself for 10 years now. It does run in our family. I'm trying to control it, I hope. Yes, I'm on medication. I do try and watch the foods I eat. I know for myself I could use more milk, but I reserve that for my boys because they are growing boys and they need it for their bones. And it's just one of those sacrifices that you do as a parent because you know that it's healthy for them. I know that my health is kind of deteriorated. I'm getting arthritis in areas I've never had it before. So because I have arthritis in my lower back, and now for some reason I'm getting it in my right arm, and I've never had that before.
Oh, here we are.
Yeah.
Sure. Oh, right on.
Oh, what happened to the crackers?
I think poverty affects people's health because when people are poor and they live in, first of all, they live in non-healthy conditions, so the houses are usually overcrowded, they're usually small, they're not the best kept units around or conditioned. They're more in a survival mode and they don't think about health promotion or health prevention, and they're just looking to get to the next day.
A couple times my son's gone into the fridge and said, "Mom, we're poor," and it's just like, hurts my heart because it's like I didn't really know that he understood what poor meant, and said, "No, we aren't. We're not poor." I said, "There's more people that are more poor than us." I said, "Daddy will get paid tomorrow, hopefully, and if not, well, we'll just go out to resources in Saskatoon to go eat."
Whether you're on social assistance, whether you're the working poor and you're making minimum wage, it doesn't really matter. There's just not enough money to buy the proper food to feed both your body and your soul. If you could imagine having, you get $985 for the month. Your rent is $850, okay? So that leaves you a very small amount of money to take care of your groceries, your personal hygiene things, your laundry soap. Poverty takes away choice on every level. Well, first of all, most people in the inner city, if they either walk or they take the bus. So they'll go to places in the inner city that's easy to reach, and they've got to carry everything. So they buy the macaroni, they buy the processed chicken fingers, they, fast stuff. They just don't have money for fresh vegetables. They don't have money for pure meat.
On whole, the city of Saskatoon is a pretty healthy place to be, but that's not equally true for all members of society. What we found, some of the major factors that impacted health were actually your income, your education, your employment. People living in poorer parts of the city with lower education and lower employment suffered much higher rates of most diseases. We were finding rates of diabetes complications for hospital to be 400% higher in the inner city compared to the rest of Saskatoon. Rates of hepatitis C that were 3,000% higher. Rates of infant mortality that were over 400% higher. Many of these were shocking for people that this degree of health disparity could be going on in Canada and within an urban environment. One of the statements we've made is that the biggest thing you could do to improve people's health is to spend a little less on healthcare and more on education and employment and social services and supports.
I don't know how people can live day to day, if you're low income.